There's a place in town that's always open, saving lives. A team of professionals committed to giving quality medical care. Good health is in your hands, in the heart of Lake Havasu.
The Havasu Community Health Foundation offers free seminars on a wide range of health issues. Recently, Blondie Miley, a registered nurse at Havasu Regional Medical Center, talked about infection prevention.
Today we're going to talk about preventing infections when you need to go for anything related for your heart. It doesn't just relate for heart procedures, but also when you're going to have any type of procedure in everyday life. When you guys get your office visit and the doc says we're going to, admit you to the hospital, it's a very simple procedure. I'm sure you've heard of a family, a friend, a coworker, somebody who that simple procedure has turned into something major. Yes? Yeah. And the sad part is it could be something that your friend, family, coworker did or didn't do. It could be something that happened in the hospital from EVS, environmental services, not cleaning. It could be from the physician picking his nose and then coming to see you. It could be from the nurses not washing their hands. It could be from all kinds of things. But what we try to teach everybody is to reduce your risk the best possible. So you might have heard where we ask our patients to have a chlorhexidine bath. Has anybody heard of that chlorhexidine soap? It's such a thing across the nation. It is what we call a best practice. So no matter where you move and which surgeon you see, if they follow best practice, they are going to ask your patients to have a chlorhexidine bath before their surgical procedure. Chlorhexidine is a very strong soap, but at the same time very gentle on your skin to help reduce bacterial load. And what they want you to do is to take a bath the night before, then the morning of, and then you go into the hospital. And then what we do on top of that is wipe your body down again with chlorhexidine wet wipes. They look like baby wipes, only much larger and thicker. And the hope is that we're reducing the normal bacteria that we carry on our body. So I'm sure many of you have heard of MRSA. Can you tell me what the initials MRSA stand for? So Methicillin-Resistant Staphylococcus Aureus. So Staphylococcus aureus is the bacteria we all carry. Everyone has it. Everyone has E. coli on us. We have all kinds of crazy bacteria because bacteria is what the world evolves on. Methicillin is the family that is part of like the penicillin group, and resistant. So that big group of antibiotics, the methicillin family, the staph is resistant to it. And so if you have an infection and we swab your culture or check your blood, put a Q-tip in your nose, have you cough in a cup for your sputum, check your urine, we're going to see if it's growing Staph aureus. And then they take this neat little tray and they put that sample in all of these little tiny trays of dishes, and it has a little bit of the antibiotics in it. And it's to see if it gets rid of that infection or the bacteria. So if it's methicillin resistant, we know none of the medicines in that methicillin family are going to get rid of staph. The problem is that methicillin resistant is what we call multi-drug because there's so many in that family. And it's very contagious in the fact that you can share it with everyone, just like you can share the flu. But the flu you can get rid of a little easier than you can MRSA. So if you're going to have a procedure, regardless of what it is, if they're going to cut in your skin from taking off, what was Dr. Ballou talking about, skin cancers or whatnot, to open heart surgery, you want to be sure that that skin and everything around it is clean as possible. And that's where using the chlorhexidine soap comes into play. If you are allergic to it, then plain old dial soap will help because it's antibacterial. And then when we're in the hospital, if you're going to have open heart surgery, we give you a bath tonight. We change all your sheets. They clip the hair because we don't want to use a razor, make sure as much hair as possible, especially our hairy men. The women, we just make sure anything that's extra under your arms or your legs, we're going to be checking on your veins. And then you get to go to bed in a nice clean bed. You get up in the morning very bright and early, and you get another shower or a bed bath if you're not able to get in the shower with the chlorhexidine again, so that we can reduce as much bacteria as possible. Now I will brag a little bit about our program that our infection rates at the hospital are very low. And people will say, oh, no, they're not. And I can say, yes, they are. And I can prove it because I have the data from when I took over as the infection preventionist in 2011 to now and able to show the difference. Now, we know that some surgeries, they're called dirty. We know they're at high risk for having an infection. So if you come into the emergency room and you have a bellyache and a small hole is in your intestine because you had an ulcer that perforated or ruptured and you have to have surgery, that's a dirty surgery. So the risk of having an infection from that is very high. But there's nothing anyone can do about it except when you're in surgery is to clean out all the inside as best as possible. But it's kind of like a loaf of bread. So you know you've seen a little piece of mold in your bread and you're like, oh, I'm gonna throw that piece away. And it didn't work because the mold just continues in there, right? So the same thing happens with bacteria. If there is a little tiny speck that you can't see with your eyeball still left somewhere, it's gonna start brewing and growing because bacteria loves warm, moist places. And anywhere where there's a dressing that's covering that's not getting changed properly, or it's very wet and warm, is going to potentially brew that infection growing. So the big takeaway from today is making sure when anyone comes to visit you or you go to visit people, use the hand sanitizers and wash your hands. You will see throughout our hospital and any others you go to that they have some type of hand sanitizer on the wall where you can not even have to touch them. They're automatic. And the reason that they've become automatic is that we know if you're touching it and having to touch the little nozzle, well, people are germaphobes and they don't want to touch that because now they're getting it on them even though they're using hand sanitizer around it, but it's a psychological effect. So if you know you don't have to touch it, it's so much easier to use it. And we know that there are certain bacteria that will never go away with alcohol-based hand sanitizer. Does anyone know what that infection might be? It has to do with the bathroom. No, you're on the right track. If you sing the alphabet, it's the third letter. No, that's the... Keep going. When I say it, you guys are all going to go. I thought I heard someone say it. It's C. Diff. Right. So C. difficile. C. difficile is one of the only bacterial infections that are spore related. So the problem with that is alcohol hand rub will not get rid of the C. difficile. So this is my little story for C. diff for you. And it always grosses everyone out, but you'll think of things differently now. So Grandpa Smith has diarrhea. And he does not understand why he has it. But he's going to go to the grocery store and he's going to get some Imodium because he knows Imodium's going to help, right? But Grandma Smith said, while you're there, you better get some fruits and vegetables because the drawer's empty in the fridge. So he goes over to the grapes and what does he do? He starts picking through the grapes, right? And he wants to see how juicy they are. So he's touched them all. He's got to go to the bathroom. So he runs to the bathroom in the grocery store and he doesn't wash his hands. And he comes back to finish picking on the apples and the cherries. And along come you. Now you're ready to get your vegetables too and your fruits. And you're like, oh, those grapes look great. They're on sale, 99 cents a pound. Let's see how juicy they are. But you just had surgery, whether it was on your teeth or your toenail getting off, whatever. And you're on some antibiotics. So one, your immune system is a little bit less than it used to be because we're older. Two, you're on an antibiotic. That helps get rid of all the good stuff and the bad stuff in our system. And now you've introduced C. difficile because Grandpa Smith had it and he was touching all the grapes that you just touched. Now you have C. diff. And we wonder why people are getting it so much more frequently in the community. So don't eat the fruit without taking it home and washing it. Don't put your purses and bags on the floor. So I'm glad to see they're not on the floor. Because if you think about where people walk, it's on their shoes and then they go into other rooms. And so like one of our policies we implemented was if a patient's in isolation for C. difficile, they have to wear those blue disposable shoe covers because I don't want to go into room A who has C. diff and take it into room B on the floor. Then you come to visit, you put your bag and everything else on the floor, and then you take it home to your grandchildren, your nieces, your nephews, and everybody else. Have you ever watched that movie Contagion? It's a really good movie about how this all works and how one little bacteria spreads so quickly, so far, and kills so many people. I actually have all the nursing students watch it to help them understand it. Because if they don't understand in their mind how important hand hygiene is and cleaning their stethoscopes and the thermometers, who else is going to know, right? So I'm glad you guys are here to learn and be an ambassador for that. So when you go to visit someone or you're in the hospital and they're coming to visit you, it doesn't matter if it's the president walks in. Wash your hands. Use the hand sanitizer. You know, don't let them come in without doing the whoop, and you can hear it if you don't see it, or they should be walking in the room doing this. We try to teach them to say, you know, hi, my name's Blondie. I'm going to rub this hand sanitizer in, because this could mean a lot of things, right? I'm cold. What am I going to do next? So we want them to tell you what they're doing, and same thing for you. Now, someone has asked in the past, if I get the hand sanitizer from Bath & Body Works or whatnot, is that safe to use? What do you think?
No.
Why?
Probably the formula isn't as efficient as it should be.
It's well enough for the general public to use, yes. Has all those perfumes and stuff in it. But for the hospital grade or healthcare grade, it has to be 70% alcohol. So if you look on your different bottles of alcohol hand sanitizer, like Purell versus, I don't know, Bath & Body Works, Victoria's Secrets, whoever those brands all are, look to see how much is alcohol percentage in there. You do want to try to get as high or as close to 70 as possible to make sure that it's getting rid of the bacteria that's on it. And then, of course, still wash your hands when possible. So technically, when you're visibly soiled, and after you feel like you weigh extra 10 pounds from using hand sanitizer all the time, then wash your hands with soap and water.
I heard that you were supposed to use hand sanitizer a lot.
There's no true data that says it's going to hurt or harm you, which is why we then say to wash when they're visibly soiled, or you start to feel a little bit funky from having so much of it on you. So any questions that you guys have so far?
The Havasu Community Health Foundation regularly conducts free seminars on various health issues. For more information on any medical issue, contact the Havasu Health Foundation. Jim Matthews, Havasu Video News.